So peptic ulcers are an acid-induced lesion of the GI tract, usually located in either the stomach or the proximal duodenum, specifically where the stomach meets the duodenum, as the stomach acid comes out of the stomach and into the duodenum. Sometimes if we don't have enough buffering activity of the duodenum, and or if there's something called H. pylori there, sometimes we get an ulceration in the proximal duodenum as well. So mucosal disruption in patients with peptic acid disease is considered to be a result of hypersecretory acidic environment together with dietary factors or stress. That's what we have typically associated ulcer formation with. Risk factors for developing peptic ulcer disease include H. pylori infection. We're going to talk about that. Alcohol and tobacco consumption, NSAID use, nonsteroidal anti-inflammatory use, and Zollinger-Ellison syndrome, where there's an overproduction of acid. The main risk factors for both gastric and duodenal ulcers are H. pylori infection and NSAID use. Those are the main risk factors. Now, when it comes to NSAIDs, this is also something that we don't talk about enough because people are popping NSAIDs out there like candy, truly. And I don't think people understand the detriment that they're causing to not just the stomach, but the rest of the gut. It's quite remarkable when you look at the research. NSAIDs are responsible for approximately 5 to 10% of all medications prescribed per year, up to 10% of all medications. The prevalence in NSAID use in patients over 65, so in older adults, is as high as 96%. So 96% of people over the age of 65 are using NSAIDs. 7.3% of elderly patients over 60 years filled at least one prescription in a 1-year period. This is a retrospective study, 3,000 subjects with chronic pain, found that 97% of chronic pain subjects took NSAIDs for more than 21 days. So people are using these things a lot for pain management. So this is a very important slide because it helps to, what I wanted to show here is the fact that when it comes to the inside lining of the stomach, what are the factors that contribute to ulceration formation? And what I really wanted to mention, we'll come back to this aspect of proton pump inhibitors and antacids in a little bit, but these are the different types of cells that help to secrete a variety of our enzymes in the gut, right? And you'll see here that NSAIDs in particular block this action of the PGE2 to PG and prostaglandin formation, which eventually leads to the formation, these types of products leads to the formation of mucus and bicarbonate, right? These are the things that help to neutralize stomach acid. Mucus, we need a healthy mucus layer. You know, when you cover this stuff in physiology class, in pathophysiology class, I love when they glaze over mucus as if it's like, oh yeah, by the way, there's also mucus secreting epithelial cells. But the mucus is extremely important for helping to protect the inside lining of the stomach. So what do NSAIDs do? They block. That's what this big red line is for. They inhibit the production of mucus. Okay. And so that is one gigantic aspect of why people who are taking NSAIDs end up with ulceration and bleeding, is because of this aspect down here. Okay. So that's a big deal. Number 2, H. pylori. H. pylori is a gram-negative bacteria present in approximately 1/2 of the world's population. Half. This is always kind of dumbfounding to me. And it is the main pathogenic bacterium involved in chronic gastritis, oftentimes a precursor to peptic ulcer disease or a standalone problem, and a class 1 carcinogen in gastric cancer. And that's something that I think that a lot of times we forget, is that H. pylori can lead to gastric cancer. 70 to 80% of patients with gastric ulcers have evidence of H. pylori infection. So it is one of the main causes. And it's been found in almost every patient with duodenal ulcer disease, although there's no direct evidence for a causal relationship that has been proven. So almost every patient with duodenal ulcer disease has H. pylori. So how does it work, H. pylori? I think we just kind of always talk about H. pylori, but we don't understand the pathophysiological mechanism by which it causes ulcers. So H. pylori secretes urease. Basically what this does is catalyze the hydrolysis of urea to generate ammonia and bicarbonate. that forms a neutral environment around the bacterial cells. These bacteria are very clever. We were just kind of talking about this, and they're very good about figuring out ways to make themselves be able to grow better, right? And this is one of the ways, is that they basically generate ammonia and bicarbonate because they contain urease. Therefore, the mucus layer changes from a gel to a viscous solution, meaning more watery, and thereby facilitating the passage of the bacteria through the mucus. The mucus is there, again, to protect the stomach lining, not just from acid, but also from other bad stuff like bacteria. The H. pylori also possess long flagella, their tails, that allow them to swim through the sticky viscoelastic mucus layer in this manner similar to how a screw passes through a cork. H. pylori, they also have adhesins that further interact with the host cell receptors. These are like little landing docks. So it's kind of like the Mars lander, kind of lands on top of the lining of the stomach. And then upon successful colonization, as they start to replicate themselves, they release proteins and toxins that damage the host tissues. And then they also, basically what's going on here is we're releasing chemokines, right? Chemokines and other types of inflammatory cytokines that eventually are going to activate our immune system and cause damage to the lining. Here again is the process. Here we have our amazing little H. pylori corkscrews, and they come along here, they go through the mucus layer, and now they're producing urease that helps convert urea into bicarbonate, carbon dioxide here, bicarbonate and ammonia. That neutralizes gastric acid, right? That's not good. So this little envelope that it forms around itself, now it's able to penetrate through, and they colonize. And now, of course, we've got mucosal damage. And that, of course, eventually leads to pepsin and hydrochloric acid that are now causing the erosion and damage to the inside of the gut lining, right? And that, of course, we're also releasing different types of chemokines and cytokines down here that eventually cause further destruction to the area. Okay, so H. pylori is nasty, because it really can get in there and cause some serious damage. So clinical presentation, diagnosis of ulcers. Ulcers can cause a variety of symptoms or no symptoms at all. A lot of times patients don't even realize that they have an ulcer until they have some of the most common ulcer symptoms, which is pain or discomfort, usually in the upper abdomen, bloating, feeling full after eating a meal, even after eating a small amount of food, a lack of appetite, nausea or vomiting. And then the things that are kind of the hallmark things to look out for, again, are always dark or tar-colored stools. And the ulcers that are bleeding can cause a low blood count and fatigue. People are losing blood on a daily basis, right? So that can show up on test as anemia. And I think this is something that I look for in all my patients. Is there any kinds of anemia or undisclosed cause? And especially in the light of any kinds of blood in the stools, you got to be really concerned about some kind of ulcer. Usually dark stools are more indicative of an upper gastrointestinal bleed, as opposed to brightly colored blood in the stools, usually more indicative of something called like a hemorrhoid or a lower gastrointestinal problem. Duodenal ulcers related pain usually occurs 2 hours after a meal, or when there's no food intake, and such are relatively tentatively by the intake of food. Okay, so they're relieved by the intake of food usually. So how this is diagnosed? Usually by a blood test or breath test, especially for the H. pylori. These are known as urea breath tests. They require patients to drink a specialized solution that containing a substance that's broken down by H. pylori, and the breakdown products can be detected in the breath. So that's what we're looking for, primarily carbon dioxide and things like that, and ammonia. The other thing is that upper gastrointestinal endoscopy and biopsies are usually done to understand what's going on at the level of the stomach lining. All right, let's start to dive into a couple of treatments here. Cabbage juice is the first thing I want to talk about. This is an eclectic medicinal food. It's been used for centuries. Ancient Greeks and Romans used cabbage to fight infections and treat ulcers. And it could be due to S-methylmethionine, which is an analog of SAMe, which many of you probably have heard about, with high antioxidant, anti-ulcer properties. And it was dubbed vitamin U at some point in time. So it may also help cabbage juice in this particular facet of cabbage juice by increasing mucin production in the stomach mucosa. So again, helping to produce mucus. A study all the way back in 1949 showed that the benefit of fresh cabbage juice in healing ulcers. 13 patients with peptic ulcers were treated with fresh cabbage juice. The average crater healing time for 7 of the patients who had duodenal ulcer was only 10 days. 10 days to heal an ulcer with using fresh cabbage juice, while the average time as reported in the literature in 62 patients treated by standard therapy was 37 days. 37 days. So divided by 3, basically. Average crater time, healing time for 6 patients with gastric ulcers now treated with cabbage juice was 7 days, compared with 42 days as reported in the literature for 6 patients treated by standard therapy. So this is really, really cool. This is a long time ago. So it's more anecdotal evidence. There's not a lot of research in the realm of cabbage juice, but I feel like sometimes we need to talk about some of these medicinal foods and things that are kind of still in the eclectic literature. Cabbage juice also has a high amount of the amino acid glutamine, which, of course, as we talked about before, is an amino acid that's the primary fuel source for enterocytes. It also aids in being able to heal the lining of the gastrointestinal tract. Really cool. So how to use this: put fresh cabbage leaves into a blender, add water using the same proportion and weight, blend the cabbage for 40 to 60 seconds using a high-speed blender, then strain the puree using a fine mesh strainer or juice using a commercial juicer. Really cool. I really, really think this is an amazing potential treatment for patients with ulcer and helping to heal craters. DGL. For those of you who know about licorice, the primary active constituent in licorice, or one of them, is glycyrrhizin. It has been shown to have an aldosterone-like effect in the body. So high dosages or chronic consumption of glycyrrhizin can cause electrolyte imbalances, hypertension, possible cardiac abnormalities. Most of the in vitro data on licorice root is on glycyrrhizin, with less information available on the other constituents of licorice. For example, glycyrrhizin and its derivatives have been shown to effectively kill H. pylori strains, including those that are clarithromycin resistant or metronidazole resistant, some of the medications that are oftentimes used in the triple therapy to kill H. pylori. So we can use potentially glycyrrhizin or licorice to be able to help to kill H. pylori. There's other types of various flavonoids found in DGL, and that is where the glycyrrhizin is taken out of the licorice, have also been shown to be bactericidal toward H. pylori, not just bacteriostatic, but helping to kill H. pylori, and may account for some of the anti-ulcer activity preserved with the removal of glycyrrhizin. So this could be primarily due to other types of flavonoids found in licorice. In addition, DGL has demonstrated the ability to increase mucin production again, possibly by increasing the number of mucus-secreting cells in the stomach. So this is a protection against aspirin ingestion. So those people who are taking NSAIDs and aspirin out the wazoo, this is a rat study. They were given a large dose of DGL, demonstrated a reduction in aspirin-induced gastric lesions when the DGL was co-administered, but not when it was given before the aspirin ingestion. So it seems to be best taken either with it or after it. So obviously to help to heal the aspirin, the damage from the aspirin, excuse me. One human placebo-controlled crossover study demonstrated that fecal blood loss induced by aspirin was significantly reduced with co-administration of DGL. Really, really cool. I really find this fascinating that using something as safe and simple as DGL can be helpful to ameliorate the side effects of these types of medications that usually do cause bleeding. In several head-to-head comparison studies, DGL was shown to be more effective than cimetidine, ranitidine, or antacids in both short-term treatment and the maintenance therapy of peptic ulcers. Just fascinating. I really love this. 120 patients suffering from dyspepsia, either with peptic ulcer disease or non-ulcer dyspepsia. Licorice was given in addition to clarithromycin-based standard triple therapy for 2 weeks. H. pylori eradication was assessed 6 weeks after therapy. Response to the treatment was 83% in the licorice group and 62% in the control group. It worked better than just the 3 triple therapy alone. It's also been shown to be extremely effective in the treatment of gastric ulcers. 33 gastric ulcer patients were treated with either DGL or placebo for 1 month. There was a significant greater reduction in ulcer size in the DGL group, 78% compared to the placebo group. And complete healing occurred in 44% of those receiving DGL, but only 6% in the placebo group. Awesome studies. Slippery elm, Ulmus rubra, is another herb. It's been used in North America for centuries. Native Americans use slippery elm in healing salves for wounds, boils, ulcers, burns, and skin inflammation. It was also taken orally to relieve coughs, sore throats, diarrhea, and stomach problems. And what do we know now about slippery elm is that it contains mucilage, a substance that becomes a slick gel when mixed with water. It coats and soothes the mouth, throat, stomach, and intestines. It also contains antioxidants that help to relieve inflammatory bowel conditions. So what it does is it causes reflux stimulation of nerve endings in the GI tract, leading to increased mucus secretion. So that's really helpful for ulcers, obviously, being able to help to protect the GI tract against ulcers and even excess acidity as well. So you can take this in a gruel form from powder. So you can mix 1 tablespoon of slippery elm with 2 to 4 ounces of cool water, letting it sit for at least 10 minutes. You can flavor it with things like cinnamon or other types of spices. You can eat it alone or add it to a hot cereal twice daily. So that's another great remedy, I feel like. Again, more things we can do to not overcomplicate things and be able to heal the stomach is great. Aloe vera gel and ulcers. Aloe vera, the source of 2 products, gel and latex, and the herbal gel has been proven to be very effective in the treatment of hyperacidity, gastric and duodenal ulcers. It's demonstrated multiple clinical activities, including helping with wound healing. This is a rat study here. They had induced ulcers. They were given aloe vera gel, and aloe showed more potent healing than omeprazole and cimetidine, 2 medications that are oftentimes used for ulcers. And so there was no traces of ulcerization observed in the stomach of the rats as early as 7 days of the observation treatment. However, the acid output in the aloe treatment groups was not significantly reduced as compared to cimetidine and omeprazole. So it doesn't seem to necessarily reduce acid, but it definitely will help to heal and soothe the lining of the stomach, being able to heal those ulcers. 60 patients with chronic ulcers given conventional treatment plus aloe twice a day or only the conventional treatment. After 3 months of follow-up, the wound healing occurred in 93% of patients in the aloe vera group and 14% patients in the control group. Really, really awesome stuff. So here is the action of aloe vera as a gastroprotective. You can see it decreases tumor necrosis factor alpha. It also helps to reduce these leukocyte adhesions as well, which helps to reduce inflammation. It helps the epithelial cells proliferate, and it's an emollient action, helping to form a layer on top of the gastric epithelial cells. So again, kind of that demulcent action that aloe vera has. So here we have our gastric inflammation. We have on this side, we've got our epithelial cell proliferation on this side here, and it's gastroprotective. It starts to form, again, this helpful mucus layer. Really, really neat stuff. And you can see also tumor necrosis factor alpha is also decreasing here as well.